Aloha from the East-West Center in Honolulu, and mahalo to viewers around the world for tuning in to today's Gals with Lay Global webinar, A Better Balance, the Fight for Family Leave. Gals with Lay Global leverages the Center's unique access to the world's policymakers, entrepreneurs, community leaders, and artists, virtually uniting these global forces with Hawaii's women leaders to harness their collective experience, ambition, and passion. Gals with Lay Global is intentionally dynamic and interactive. We will begin with our keynote panel, followed by 30 minutes of Q&A. Open Space will follow Q&A as an optional opportunity for attendees to meet the speakers at virtual roundtables and participate in an unmoderated and informal dialogue for 10 minutes. Open Space is a unique opportunity to engage and network as peers with our esteemed speakers and your fellow attendees. We encourage our audience to participate in and take advantage of the access Open Space provides. My name is Sarah Lamb, and I am the Gals with Lay Global Co-Coordinator. It's my pleasure to introduce the experts and advocates who will be discussing the challenges and inequitable distribution of caregiving, the benefits of paid leave, and why employers and policymakers should embrace policies that will allow employees to balance career and family during the pandemic and beyond. Dr. Machiko Osawa is Professor Emeritus at the Research Institute for Women and Careers at Japan Women's University and author of Women and Work in the 21st Century and Why There Are So Few Women Managers in the Japanese Workplace. A social justice activist from New Zealand, Ms. Sue Moroney was a Member of Parliament for the New Zealand Labour Party from 2005 to 2017, where she successfully led a campaign to extend paid parental leave to 26 weeks. She is currently the Chief Executive Officer of the Community Law Centers o Aotearoa. Nancy Nagao leads the Change Culture and Inclusion Consulting practice for EY Japan, where she helps clients align their people and culture to the company vision, as well as develop and implement local and global diversity and inclusion strategies. Finally, Ms. Kathy Betts is Director of the Hawaii Department of Human Services, where she continues to further the department's vision through her experience, advocacy, and commitment to helping the people of Hawaii thrive. She previously served as Deputy Director from 2017 to 2020 and as Executive Director of the Hawaii State Commission on the Status of Women. And now I would like to take a moment to share our webinar protocols. Today's keynote panel is on the record, recorded, and will be made available on YouTube for viewing and sharing. Each panelist will speak for up to 7 minutes. Viewers, your microphones and videos are turned off during the keynote. If you are experiencing difficulties with internet connectivity, AirMeet provides a low definition option at the bottom right of your screen. For the best attendee experience, please connect to AirMeet using the most up-to-date version of a Chrome browser. The webinar is also accessible through AirMeet's mobile app, available to download to any iPhone or Android device. Q&A will take place after panelists' remarks. To submit a question, you may either virtually raise your hand using the hand icon or use the Q&A function at the right of your screen. In either case, please specify which panelist you would wish to answer. If you don't have a question of your own, you can also like a question asked by a fellow attendee. Questions with the most likes will be prioritized. Once Q&A concludes, viewers will have the option to meet our speakers by taking a seat at any virtual roundtable of your choosing and participating in an unmoderated interactive discussion. We encourage you to share the space and your voice. Also, join the conversation on Twitter using hashtag #GalsWithLay and follow us on Twitter and Instagram at EWC Seminars. Finally, I am delighted to introduce today's moderator, Ms. Christina Marie Sablon. Tina is an elected representative in the 22nd Legislature of the Northern Marianas Islands, where she serves as chair of the House Standing Committee on Health and Welfare. She is also an alumna of the East-West Center's Changing Faces Women's Leadership Seminar. And with that, I'll hand over the program to our moderator to offer brief contextualizing remarks. Tina?
Thank you, Sarah, for that introduction. And thank you, East-West Center and Gals with Lay organizers for hosting this important conversation on the quest for more equitable family leave policies. Paid family leave is such an important piece of the puzzle in creating workplaces that are more balanced, more productive, healthier, and happier overall. And thank you for inviting me to moderate this discussion. As a member of the legislature here in the Northern Marianas, which is a territory of the United States, I've been involved for the last couple of years in advocating for more equitable paid family leave benefits for our government employees and for a Commonwealth-wide policy for paid family leave for all workers. We frankly still have a long way to go, as does the United States. For anyone following this issue, it is common knowledge that the US lags behind most countries and that there is still no national policy for paid family leave for workers. The COVID-19 pandemic has spotlighted the cracks and inequities in virtually all of our systems, including our workplaces, and the disproportionate burdens placed on workers, women especially, who lack access to paid leave when they need to take time off work to care for themselves, their children, or other family members. Like any crisis, COVID-19 has presented opportunities as well and spurred action to address these gaps. In the US, with the public health crisis in the backdrop, legislation is now moving through Congress with perhaps more traction than it has ever had before to finally provide a national program of paid family leave that would benefit most workers in America. There is so much that we can learn from other countries and from companies that have adopted progressive policies that recognize the value of paid leave in recruiting and retaining talent, boosting productivity, and ensuring safer workplaces and better health outcomes for workers and their families. We have a fantastic panel of speakers lined up to share their perspectives and expertise. I want to thank them for their efforts in advancing the fight for family leave in various spaces and for bringing their wisdom to this forum today. I also want to encourage our audience to please pick their brains, submit your questions, and stick around for open space to continue the conversation. And so let's begin with Machiko. You have the floor.
Hello, my name is Machiko Sawa. I'm a labor economist, and I have been working on the issue about the work-life balance. And today I just want to talk recent development of paternity leave, expanded and much easier to use, and we were hoping that would change the division of labor between Japan, between men and women. And George, can you show me that the PowerPoints I just gave it to you? Yeah, this is, I just prepared just a little bit of next page, please. So that I just want to show you, this is the most important part of it is, this is Japan, that the very low men's domestic work participation, and this is a men's domestic work participation, and compared to US, UK, other, France, other countries, and very distinctive. And then usually like 80% of the work has been done by women, and 20% of men are doing the household chore. But it's increasing, the 30 to 34 age group. Men's spending time of household chores increasing, but not enough. Please, next slide. And then there was the project, equipment project, supporting father to take care of kids, and it started 1999, but the more seriously started 2010. Please, next slide. And then yeah, this is a new poster, and sort of encouraging the environment more. Father, Papa will take care of a child. And please, next page, please. Then the right now, this is most recent survey. 70.6% of household chore was done by wife, and the husband is 32.3%. And then looking at the child care, about the same, but the child care a little bit more percentages. Men are taking care of children. Next page, please. And then the this is the trend of men taking child care leave. this year is the first year that the more than 10% of men is taking child care leave. So the child care leave is about a year, and you can break it up, especially for the first 8 weeks. That you can break up 2 times, and then the income replacement ratio is about 80%, and you can take a year. So, which is one of the very generous policy. Yet, only in the private sector. This is the private sector. The 7.48% of men are taking child care leave. So. Still, even though the national civil servant are taking more childcare leave, but still has some obstacle for men to take childcare leave. Next page, please. So, so what is the problem? That I told you already that our paternal leave registration is quite generous, and then 80% of income is guaranteed. That however, the 70% of father took less than 2 weeks, so very short time period. Why is that? So my opinion is that the corporate culture is the problem. That if you can take it, and you can take paternity leave, but the speed of the promotion income had there's a empirical study shows that there's some detrimental effect of future promotion and the income. So still, there's a very male-dominated corporate culture in Japan, and that has to be changed in the future. Thank you very much.
Thank you so much, Machiko. And Sue, you now have the floor. Sue, I think you're still on mute.
Thank you very much. George, could I have the slides up, please, for my presentation? Well, greetings from Aotearoa, New Zealand. I thought that I would just give you a very quick rundown on our country. Some of you may not know much about us. We're a very small nation, right down the bottom of the world in the South Pacific, with a population of around 5 million people. And if you could go to the next slide, please, George. Importantly for this conversation, part of our history is that we were the first country in the world where women won the right to vote, and that was way back in 1893. But despite that, we still didn't have any access to paid parental leave until the year 2002, and we were behind more than 100 other countries who already had gone down this path. So New Zealand has been quite late to the party in this regard. When we did bring it in 2002, it was introduced at the level of just 12 weeks paid parental leave. It's completely paid by government from general taxation, so employers don't pay anything towards paid parental leave by statute. At least they can always do that voluntarily, but they're not required to. And it's paid at the average wage of the weekly rate in New Zealand, and currently that's $621 a week. It was later on extended to 14 weeks paid parental leave. It was extended to parents who are self-employed as well. And the qualifying period was reduced from being that people had to be in 12 months of continuous employment. That was reduced down to 6 months. And either parent can qualify to use this leave if they are the primary carer for the new baby. Next slide, please. So when I came into Parliament and to the New Zealand Parliament in 2005, we had 14 weeks paid parental leave, and I started a campaign to extend that 26 weeks paid parental leave. I did that on the basis of that being the World Health Organization's recommendation for breastfeeding, and I felt that this would help to improve breastfeeding rates. You'll see that it was, I was in opposition at the time, so I had to wait some time between 2009 when I wrote my bill and 2012 when it finally got to be debated. But it was opposed by the government of the day. However, because of our parliamentary system, it did have a one-vote majority and was able to be voted on. Importantly, it was supported by 62% of New Zealanders. If we go to the next slide, I'll talk a bit more about how we achieved that. If I could, thank you. So some of the arguments that we used for and against it, the main thing that we talked about was it being about the healthy development of children. This actually brought a whole lot of both political and community support when we talked about children being the focus of this legislation, rather than women's participation in the workplace. It really changed the narrative, possibly for all the wrong reasons, but it meant a whole lot more people could support this idea. We said it was about supporting working families, that it improved maternal mental health, it brought about more employment, and it's therefore all of these factors reduced the costs for the government. And that for employers, it meant that they would be able to retain valuable staff who they had actually already invested a lot of time and training into. The arguments that we use against it was about the increased cost to the taxpayer, that some people felt that employers might be less likely to employ women because of this leave, and that they would need to replace staff while the parental leave was taken. Next slide, please. So there are a lot of things that happen politically. I'm not going to dwell on this slide. But the important thing about this is that even though the government of the day was opposed to paid parental leave, had always voted against it, this campaign even forced them to extend paid parental leave to 18 weeks in Aotearoa, New Zealand, which they did. Next slide, please. I think the key to this was the focus on children, as I said before. It made it very difficult for anyone to argue against the merits of, if this was a good thing for children, then it was great for our society. We used the mountains of research and evidence that are available internationally to convince people of this fact. That helped us gain political support, and it kept the community support growing all the way through. And that was the constant momentum that was required from that came from a coalition of community interests that I brought together that helped campaign for this constantly. Next slide, please. So this is a picture of myself and some of the people who had been campaigning, celebrating the success after the first vote on this legislation. We always brought babies and their parents into Parliament on every occasion when this legislation was being debated. They came and they presented to committees. They were out in the community campaigning for this. And they were always in the media talking about the importance of it as well. So I just wanted to leave you with that image, because to me, this was the very important element in the success of this campaign, was always having babies and their families at the forefront of it and having them involved with it. Thank you.
Thank you so much, Sue. And now let's hear from Nancy.
Great. Thank you, Tina. So I'm very happy to be here today to represent the business perspective as well as EY. And if you'll indulge me for a moment, I'd like to share my personal story as a way of contrasting US and Japan approach to family leave. So upon graduation, I joined EY 37 years ago in our LA tax practice at a time when there were no women partners. And my first exposure to a female partner was 5 years later when we merged with another company. 9 years after that, I became a tax partner in New York and eventually became an HR leader for the Americas. And I've always been very driven, completely focused on my career, basically a workaholic. So when at age 40, I welcomed my first son, I worried about how I was going to continue my work style and my career and raise a child. I literally worked up until the Friday before my son was born. But our paid maternity leave was 6 weeks for a natural birth, 8 weeks for a C-section, which was actually very generous at the time. And but I had never really been away from work that long, so I thought I didn't even need that much time. You know, when I got home from the hospital, I was immediately checking emails whenever the baby was sleeping. But on my first day officially back into the office, you know, as I walked in the elevator, you know, I felt as if I had never left. That is until somebody came by my office and congratulated me about the baby and very innocently asked me, you know, how the baby was. And out of nowhere, I burst into tears. You know, I had never cried at work before. I had no idea where it was coming from because I really was excited to be back at work. But upon reflection, I realized it was just too soon for me to go back to work. Physically, yes, my body was healed, but you know, my hormones and my emotions just weren't ready. I was in a very fortunate position because I was able to hire a nanny, so my child was at home, but I couldn't help but thinking how heartbreaking it must be for a new mother to leave their precious 6-week-old baby at a daycare center. I mean, the overwhelming emotions they must feel. Today, things are much different. At EY back in the 90s, when competition for talent was fierce, EY realized that we spent so much time hiring the very best talent, but we're losing our female employees at a much faster rate than men. You know, and with an employment at will culture, leadership knew that they needed to do something. So that's when they really accelerated our D&I efforts. And today, EY has, in the US, has 16 weeks of paid leave and just a ton of other benefits, financial, supportive services. They have unlimited paid leave and full flexibility. And the results are evident. If we look at our statistics last year, 40% of our US partner promotions were women. So now I'm in Japan. I've been here for 13 years. I'm an HR consultant, but I was the head of HR for a while in our tax practice. And I was really surprised how many labor laws there are in Japan. Companies are basically responsible for the health and well-being of employees. And it's really built around this notion of lifelong employment, the philosophy that was put in place, you know, many, many years ago. So new mothers in Japan have a very different experience. You know, as Machiko mentioned, you know, we have when we have maternity leave or childcare leave up until the child turns 1 or 2, actually, if they can't get into daycare. And we're also required to provide our employees with 6 weeks of leave before birth. So it's a very different experience. Our leave policies are very generous, but there's other challenges. You know, I think about our challenges as before the baby is born, while the person, the mother or father is on leave, and then returning to work. So before the baby's born, we have something women are concerned about called matahara. It's short for maternity leave harassment. And, you know, women receive comments like, you should quit your job. You know, it's your duty to stay at home and take care of the baby. You know, don't go back to work. You know, and this is reinforced from, you know, family members, in-laws, the school system. There's just a whole host of pressures. And so, you know, the mothers really do feel guilty or feel selfish for wanting to work. And the comments aren't really made out of malice. It's just the cultural expectation in Japan society historically. Things are changing, of course, but so that's one element. And while on leave, you know, if you do any work, the benefits that Machiko mentioned, you actually lose the benefit payments if you do any work while you're on leave. So what companies do is they'll take away your computer and they take away your phone, so you're completely kind of blacked out from work. So if someone is in a profession that's rapidly changing, being out for 2 years could have a very practical impact on your career. So that's while you're on leave. And then returning to work is challenging because it's difficult, really difficult to get into daycare. And so parents and the companies really can't plan for when you're going to be back because you don't know. The positive is that public daycare is subsidized by the government, so it's very affordable. Private daycare is about 2 times the cost of that, and private nannies are, that's just a luxury, and it's really difficult to find. Last year we had about 12,000 children on the wait list, just to give you an example of how difficult it is. So that's why companies in Japan like EY, we provide, a lot of additional benefits. Like we do give women the option of having a company iPad so they can chat with their colleagues or do e-learning if they want to. There's no requirement. We provide coaching and support so families can find daycare, and we also provide subsidies, and time off for child and elder care. And we provide training and integration support upon returning to work and full flexibility. So our policies are very similar to the US, with the exception of the 16 weeks versus 1 to 2 years. But in summary, the US and Japan policies are really a reflection of the country philosophies and culture, right? The US is really heavily influenced by talent competition, whereas in Japan, the laws are really reinforce that companies are responsible for their employees. And, there's no right or wrong. They're just different. So thank you.
Thank you, Nancy. And last but not least, Kathy, the floor is yours.
I feel like every presentation starts with, sorry, I'm unmuting. Hi, everybody. I'm Kathy Betts. I'm the director of the Department of Human Services here in the state of Hawaii. Previously served as the deputy director, and prior to that, as Sarah mentioned, I was the executive director of the Hawaii State Commission on the Status of Women, where I began some of the state's work on furthering paid family leave throughout the state. Along with, I know that Hawaii Children's Action Network, I believe, is here today. So they were a good partner when we received the 2016 Department of Labor grant for paid family leave analysis. So through that grant, we were able to do an actuarial focus groups, look at community perspectives as well as employer perspectives in terms of how we could further paid family leave in the state. I'm going to go ahead and ask you folks to start my slides. Thank you so much. So as I mentioned, my name is Kathy Betts. Just a little bit about the Department of Human Services and why we took such a keen interest in family leave. We oversee SNAP, temporary assistance for needy families, child welfare services, adult protective, child care subsidies, homeless programs, among others. So some of our clientele are some of the most marginalized individuals in our state. They're most likely to not have any access to paid leave or unpaid leave at any given time if they're in the workforce. Next slide, please. So I like to use this slide in my presentations because Hawaii is such a unique place. Aloha Spirit is enshrined in our state statute. And what we really endeavor to do is create services with the Aloha Spirit and treat the public and the residents that we serve with the Aloha Spirit. And when I look at this slide, it reminds me of our mission here at the Department of Human Services and why paid family leave is really central to some of the work that we endeavor to do. Next slide, please. So in 2019, we were able to pass an integrated multi-generational approach to reducing intergenerational poverty into state statute. This is really looking at the social determinants of health and well-being. And obviously we can see why paid family leave, paid sick leave is central to creating healthy families and creating well-being amongst families. So what we're really tasked to do is to improve the social well-being, economic security, and productivity of the people of the state and reduce the incidence of intergenerational poverty. And so we recognize that having access to work supports and economic security is key to creating healthy families, not just heterosexual 2-children households, but in Hawaii, we have the highest percentage of multi-generational households. We have a lot of sandwich generation individuals and workers who are still attached to the workforce, but are also caring for young children, as well as elder parents or aunties and uncles, grandparents, what have you. Next slide, please. Sorry, this font's a little bit small. So some of the challenges in inequitable distribution of caregiving, not just in the US, but also in Hawaii, we remain one of 2 countries that have no paid family or medical leave, while our Family and Medical Leave Act creates unpaid leave with job protection. That's not necessarily leave that people can take when there's no pay attached to it. Nearly 1/3 of employed women in the United States who give birth do not take any maternity leave and are back at work within 2 weeks. 1/3 of workers across the US have no access to any form of paid time off. That's similar to workers in the private sector in Hawaii. 93% of low-wage earners have zero access to paid leave. So when we think about social determinants of health and well-being, we really have to be thinking about the impact that no access to paid leave has on families and economic well-being and health. In Hawaii, 2/3 of private sector employees have no guarantee to any paid time off at all, and that includes paid family or paid sick. So people are really between a rock and a hard place where they have to decide whether they're going to keep attached to the workforce or whether they're going to take care of their family. We've seen during the COVID pandemic, folks have to make that tough decision, either leave the workforce or potentially leave their children or their family in not necessarily safe or ideal situations. And I don't think it's something that any parent or caregiver takes lightly when they're faced with either sinking into deeper poverty or having a child in an unsafe situation. We really shouldn't be asking anybody to make that decision. Across the US, 2/3 of those who need leave cannot because they cannot afford it. And as I mentioned in my previous slide, we have the highest number of multi-generational households in the nation. We also have the highest cost of housing and the highest cost of living in the nation. So it just creates kind of a trifecta of an effect on our working families. We have many working families that are very, very short of living on a living wage, and they have multiple jobs. So you can imagine that when COVID hit and many of our families were in service industry jobs and lost their multiple jobs across the board throughout the household, that has a deep impact on future health and well-being for families, for children, for anybody in a family or a household. Next slide, please. So here's the legal landscape of family leave in the United States. I just wanted to kind of go over some of the laws that we have. They're not so robust, as you can see. Our FMLA, it's the only federal law designed to create access to leave, and it allows 12 weeks of unpaid leave for employers with more than 50 employees. It does create job protection, so someone can be assured that they're able to go back to their work after the leave. However, it's unpaid. And hopefully this United States Congress will change that. The FMLA also leaves about 44% of the workforce without coverage if they're at positions or employers with less than 50 employees. Our Hawaii Family Leave Law allows for up to 4 weeks of unpaid leave for employers with more than 100 employees. And I have to say that this is a typo. They do have job protection. So there is job protection, but as I mentioned on the previous slide, with the cost of living and inability to take unpaid leave, this really isn't, it doesn't do much for working families in the state. Historically, as we all know, that due to a lack of political will at the congressional level, states and cities and counties have really taken the lead on paid leave across the US. So they've really created a patchwork quilt of leave and job protection. Some have, robust temporary disability insurance programs on which they can lay the foundation for family leave programs. Others created different types of systems. The majority, or if not all, are social insurance programs. So California, New Jersey, Rhode Island, New York, San Francisco County, DC, Washington, Massachusetts, Connecticut, Oregon, And I believe Colorado also has a law in place, but not a program set up just yet. So it is growing, and we're hopeful with the 3.5 trillion budget bill before Congress right now that includes increased childcare, universal pre-K, and paid family leave. We're hoping that this is a time in the United States that will turn the tide and be able to provide more benefits to working families that need them. Next slide, please. And I think many of the speakers have already mentioned why paid leave policies benefit employers. They have an incentive to allow, at least for social insurance programs, employees to have a pooled benefit rather than paying out of pocket. It doesn't come from the employer, it comes from the employee. Employees have a sense of loyalty to their employers when they have paid leave. As I mentioned, state-run public insurance programs are more cost-effective and accessible than private plans. And especially when we hear a constant rhetoric that will put small business owners out of work and out of business, that's actually not true, because small business owners benefit the most out of a government-run program because they don't have to fund it out of their own pocket. And studies of current state-run family leave programs have found that businesses save money by improving employee retention, decreasing turnover, improving productivity. And I always I ponder how much paid leave is always attached with productivity and retention, when we really know that paid leave helps the public health. It decreases public health costs down the road. It allows individuals and families living in low-income families to have bonding and attachment with their family members, thereby increasing, things like literacy, decreasing child abuse, improving access to well baby checkups, all of these things. And when we, there's a moral argument to be made that is detached from capitalism and detached from private industry that I think sometimes gets lost in the conversation. Next slide, please. So I mentioned some of these, but there are long-term health outcomes to be one. Improved well-being of families, economic self-sufficiency. We are better able to allow elder family members to age in place. Workers don't exit the workforce. Early bonding and attachment is foundational to future learning and health outcomes. This is all things that we know as either caregivers or parents ourselves. We know that time off to spend with family and to care for them when they're sick or ill, or when we welcome a new child into the home, is absolutely crucial to a family's health and well-being. As Masako mentioned in the beginning, Machiko, I'm so sorry. Fathers are more able to bond with children or care for family members, which leads to more equitable caregiving long-term. And we do see that in some of the states that have paid family leave policies. Fathers do access them when they are available to them. And next slide, please. So tying it back to DHS, it's consistent with our values, which is to improve long-term health outcomes, improve economic self-sufficiency, increase men's role in caregiving. Access to paid leave has shown a decrease in child abuse and better health outcomes for women, and creating paid leave benefits all family members, thereby improving health and well-being for the whole family. And that's it. I really welcome and I'm grateful for the opportunity to share some of our considerations and insights on paid family leave. Thank you.
Thank you so much for that, Kathy, and all of our panelists, Nancy, Machiko, and Sue. So we'll move on now to the question and answer portion of this program. And I can get us started with a couple of questions, and then we can move to questions from the audience. So if folks have questions that they'd like to enter, or if you want to vote on questions that you like and want to be asked, please start doing so. So my first question is for Nancy, actually. I was interested in Machiko's focus on paternity leave and the expansion of paternity leave in Japan, and but also her note that there are still barriers in the culture for fathers feeling like they are able to or should be able to avail of the full extent of their leave benefits, right? And you talked about also the culture of matahara and these other barriers that women face, even when when the benefits are available, and taking advantage of them, to take care of themselves and their families. And could you talk more about the work that you do in changing the culture of a company, changing corporate culture, and even the culture of the country? Where do you begin?
Yeah, that's a really great question, Tina. And it's not easy. First off, I'll say, I did culture change in the U.S. I've done culture change in Japan, and in both places it's difficult, but especially difficult in Japan because the culture is so tight. It's so well defined and high expectations, and it's an island. And 95, 96% of the population are native Japanese. So it is difficult. In the corporation, you have a bit more control in that you can try to drive change. It takes a lot, though, and you have to have very, very strong commitment at the top of by leadership. And the leadership may be passionate about the topic, but what's going to move the organization is the business case. So what is the business case for making sure that men can take the paternity leave? And that's really where we start. And then we have to lay out a plan for how to move the culture, right? Define how far do you really want to be, and what can you do to get there? And it's a top down and a bottom up, right? From the bottom, you have to have some brave souls saying, this is important to me too, and this is why. So you've got the top down and the bottom up, and you have to measure. So as an accounting firm, measurements are very important to us, but as a culture change specialist and just change management in general, we have to measure. And so at EY, we put in place some goals, and we said, this is how far this is where we think we can get to, and let's make sure we're doing everything we can to get there. And we have really worked hard at trying to make a safe environment for our men to take paternity leave. We're finding the younger generation, even in Japan, is very interested in being more participatory in the family unit and participating in the responsibilities. And Machiko shared some statistics, and I don't know if she has it broken down by generation, but you would probably see that as well. So kind of bottom up, top down, and measure.
Thank you. And Machiko, did you want to address that as well? Okay. I can't. Are you unmuting? I'm sorry.
I just say like Nancy's presentation was very, very good to describe the difference between the two countries. And then, of course, it is, the changing culture is very, corporate culture is very different, I mean, difficult. And I just want to add a little bit, and although that the Japanese labor law really sort of is good to provide the year leave, but not all of women are taking leave, or that half of them not taking leave and quit the job. So it really, the waste talents were taking place. And then the other issues, I think somebody mentioned about poverty. If women are the non-regular workers, there's a regular workers, they're allowed to take a childcare leave. But if you were sort of temporary workers, dispatched workers, or part-time workers, they're not have a right. Most of the workers do not have a right to take childcare leave. So this is another issue that we have to work on it. So I did not want to praise that wow, so many Japanese men are taking childcare leave now. This is sort of, it's a small change. It's a significant change, but the overall picture of what's going on in Japan, not so bright. And as Nancy mentioned, that Matahala, that during COVID-19, some women lost the job. Even they were taking a childcare leave, and then the employer says, "You don't have to come back. You can take care of baby." So I think it is it's a difficult task, and I think we have to work on it hard. Thank you.
Thank you, Machiko. It sounds like all our countries have a long way to go. And I just shifting gears a little bit. Nancy spoke about the making the business case for improving family leave policies and changing corporate culture that way. But Kathy, you spoke very passionately about also making the moral case. And Sue, your presentation addressed or noted how the focus on children in the campaign for paid family leave in New Zealand really seemed to turn the tide and get more public support, and finally the politicians on board, right, to enacting a paid family leave policy in New Zealand. Kathy, could you mentioned this 2016 actuarial analysis that involved data from employers and employees. Could you talk about how the moral case for paid family leave has been made in Hawaii, and to what extent have the benefits for children, for example, have been part of that discussion?
That's a great question, Tina. Well, a lot of times when we would advocate for paid family leave to pass in the state, we would bring out, parents and children and families. There still is very much, I think, a perspective out there, and it is somewhat dominant, that children and families are a private individual's obligation, responsibility. You hide them. And obviously when, my two sons jump on my lap or ask for dinner during the middle of a webinar with my entire 1,800 employees, people have to recognize that we cannot invisibilize our families anymore. They exist and they have a right to exist, and we have a right to take care of them. So I do think that post-COVID, if we get to that place, I think that people will much better understand the impact that lack of childcare, lack of family leave, et cetera, has on working families. I struggle a little bit with this question because I do think so much of it is tied on how our families can prop up capitalism and keep the economy going, when at the end of the day, during a global pandemic, we really should be thinking about public health and keeping everybody safe and healthy.
Well said. And I just wanted to ask Sue real quick if you wanted to address that as well. You talked about the mountains of evidence about how family leave benefits children. And since paid leave has been enacted, have there been mountains of studies about the impacts of family leave on the health outcomes of New Zealanders?
Well, it's interesting because even though we'd had paid parental leave in since 2002, when I was mounting this argument in 2012, there was no data or research that had been done locally to find out, what the impact of that was. But there was a lot of information available globally. So we used a lot of the international research and evidence. But we did even have our own Ministry of Health mount an argument that there was no correlation between extending paid parental leave and improved breastfeeding rates, which seemed a very strange thing for a Ministry of Health to argue about. But we did see from the time of 2002 in New Zealand, our breastfeeding rates increased substantially over that period of time. And yet the government agency that was charged with considering health measures would not accept that the introduction of paid parental leave had any impact on that. So, sometimes you are having to actually argue with your own supposed experts on these subjects because sadly they do get politically driven by the government of the day, who were opposed to this measure taking place. I should have actually said in my presentation that we actually did achieve 26 weeks paid parental leave in 2017. So these campaigns take a long period of time to bring about. My experience was that when we were able to present the evidence And remember that in 2009 and 2012, around about that period of time, was right as we were all experiencing the global financial crisis. And so there was strong measures from governments, including our own, to take austerity measures and to cut funding for initiatives rather than add funding to it. So the fact that in that environment, 62% of New Zealanders said we should do it anyway, was actually quite remarkable. I felt really proud of our country for that, but I also recognised that it was because the research and evidence was undeniable. So, I think that's really important to bring that into the conversation, keep talking about how it improves the health and well-being of our children and our families, and therefore how that improves our society.
Thank you, Sue. And I'm going to look over the questions now from our audience. Our first question here is from Liz and for Nancy. You mentioned that EY was initially propelled to adopt family leave policies as a means of attracting talent. Do you foresee more American businesses embracing similar policies as a consequence of the pandemic?
I'll go ahead and start. Definitely. We did a study recently that showed this was a global study, and we had over 17,000 people participate. In the US, they said there was, I think, 55% of the people said that they would consider quitting their job if the company didn't provide them the flexibility that they wanted and needed. So there's definitely, and we're already seeing, a lot of people quitting their jobs. We have a lot of clients that we're helping them with because they're losing people. And then as we see the statistics in the US, right, there's a lot of job openings and nobody applying. So I think there's more realization that family is important. As I think it was Sarah was saying earlier, recognition that, you have to have that balance in your life. So I definitely see that in the US happening already.
Thank you, Nancy. And this next question is for Sue. Do you believe the extension for paid parental leave opened the door for more? How have paid leave policies progressed since?
Well, thank you for the question. Yes, look, there's a growing conversation in Aotearoa New Zealand now about having specific leave for fathers, because as I said, our policy at the moment is interchangeable between either parent. It's one parent or the other. And in fact, for a long time, our policies had a focus on the mother, and the mother had to give permission for the father to actually have any proportion of that leave, which I quite like personally. But it was very focused on the mother being the primary carer. Now it's much more open than that. And so I think that now that we've got to 26 weeks paid parental leave, I think that starts to open the conversation up for what leave might be there for the exclusive use of the other parent, whether that be a father or not, the other parent to be involved, because I feel that once we get past that 26 weeks, which the World Health Organization says is the ideal period to try and keep breastfeeding going for, if you can, fathers are wonderful. They can do all sorts of things with babies, but the one thing they cannot do is breastfeed. And so for us in Aotearoa, New Zealand, that I believe that when we start getting beyond the 26 weeks, the 6 months paid parental leave, that we will see that uplift more by fathers and the other parent that's not the primary carer in that initial time. So yes, it has. I think what it's meant for us as a country is that everyone understands that this is now a journey that we are on. That we're not stopping at 26 weeks. We know that places like the UK for a long time have had 39 weeks in place. These are the countries that we like to compare ourselves with. Places like Australia, Canada, the UK. The Scandinavian countries are countries that we look to all the time, and we know that certainly many of those countries have superior policies to what we do, and so the conversation continues.
This next question is a follow-up to that, Sue. Does New Zealand's family leave policy apply to elder care? And is that, do you think, the next legislative and advocacy chapter in fighting for family health?
Oh, that's a really interesting question. No, it hasn't been extended out to elder care. There have been some conversations about that, but I would say that there's no major drive for that in Aotearoa at the moment, in New Zealand at the moment. But I think that it does lend itself to a discussion about broader family leave and the different sorts of pressures that families have on them. I also feel that, along with other presenters, that our experience as we respond to COVID-19 does force us to think about all of these things, about the many pressures that are on our families that are structured quite differently to each other, and how that all manifests itself. I should also point out that at the moment, on the issue about fathers, and I'm sorry, I'm morphing into a different conversation here, but the involvement of fathers, we're very fortunate in the moment that our Prime Minister had her first baby while she was in office as the Prime Minister, and her partner is the primary carer of their baby. And so that sort of leadership is actually really important in terms of showing other families how we can actually do this in a different way. She's yet to get into the stage where she will be responsible for her parents at some point, but maybe that's the next iteration of leadership, will be showing how family leave can extend beyond the care for young children.
Thank you for that, Sue. And can I just say, before we go on to the next question, that I'm a huge fan of your Prime Minister. She's got plenty of fans here in the Northern Marianas.
She's a friend of mine, and she's from my party, so I share that.
Our next question is for Kathy. What do you foresee for paid family leave in Hawaii post-pandemic? Someday we'll get to the other side of this. What's in the future?
I hope so. I think there's going to be a battle of perspectives. First, COVID has really laid bare the inequities and in access to family leave. I mean, luckily we were given some federal relief in the FICRA leave that happened at the very end of the Trump administration, and then I believe some leave was extended, but not a lot of people in Hawaii were eligible to take that emergency leave, and it was kind of a mad dash and scramble for employers to kind of understand the legalities surrounding the coronavirus relief, paid family leave and unpaid family leave, et cetera. And so I think there's going to be a kind of a battle. There's folks on one side that are going to say, well, you've seen it. Here's the proof that that families really needed this when we needed it most, and it wasn't there. And then I think people on the other side are going to say, our economy has tanked. Our economy's been so, we had the highest rate of unemployment in Hawaii out of the nation at one point in time. So I think there's going to be that kind of argument to be had. However, I am extremely hopeful in the Biden-Harris administration in the $3.5 trillion budget and infrastructure measure that is, I think last week Ways and Means was doing the markup of the family leave section and the child care subsidy section. So there is hope on the horizon, and I'm really, really hopeful that a federal mandate will be sent down that will make it very clear the values of this administration.
Thank you for that, Kathy. And actually, this next question is a follow-up on that point. What can individuals do in Hawaii to further progress family leave?
I think individuals and families can always voice their concern for the need of access to family leave and sick leave. I especially, speaking on sick leave, we're in a pandemic. We want people to have access to sick leave and also have an ability to go back to their job and be attached to the workforce. So I think that's a huge thing. I think that people can always, sometimes a person in my office, I'll say, I'm sorry, my son needed something when I was on this call, and they're like, first of all, don't apologize and let them come on screen so that we can normalize the idea that we are working families. We have lots of juxtapositions and, differences in the way we live our lives, but at the end of it, we all have families, and we all care about our jobs and care about the economy and care about other people's families and how they're doing. So I think just normalizing family, that sounds so basic, but it's true. And I think that this pandemic has truly uplifted that information for folks that maybe didn't see it all the time, because we were encouraged to hide the fact that we had families and had jobs at the same time. Sorry, that was a very long, convoluted response, but
very well stated. And I will remember that next time my dog barks during a Zoom call. And I will not apologize.
Family. It's a bumper sticker.
This next question is for Nancy. What effect has the pandemic had on EY and other companies' D&I strategy?
Yeah, great question. It's really interesting. You always, as a change person, we always say, you should take advantage of a crisis situation to advance your culture, whatever that culture is that you want to. But we don't have to work that hard this time, because everyone was in lockdown, men and women together. So men actually saw how much work it was, that the women have to do, taking care of the kids, helping kids with homework, cleaning the house, and working at the same time. And so I think they gained a much stronger appreciation. So, we see companies, because most of the people running companies are men. So you see, a lot more policies around daycare, supporting, giving more subsidies, really trying to create an environment where both parents can balance taking care of their family and working. So at EY, we've always had great policies, but we've added to that even more around, subsidies for daycare and, partnering with third-party babysitting companies to provide, care, as it's needed. So, just a lot more policies and support, empathy for women. I would say on the other aspects of D&I, it's also been fantastic. Another area that I'm very passionate around, people with disabilities. And we're seeing much more hiring of people with disabilities, because companies now know in Japan that they can work remotely, that people will actually get work done. You don't have to be sitting right next to them to know that they're working. So that's been another benefit, if you will, out of this, really challenging time is more comfort with working remotely, which helps everybody.
Yeah, thank you, Nancy. And I'm going to direct this next question to you, Nancy, as a follow-up. With remote work becoming more and more normalized, would you say that this is a factor working against individuals who are fighting for more time at home with their families?
I guess there are definitely some people who are uncomfortable being remote, and we've been remote now for at least some people. Many people are back in the office, I will say, but at least in my profession, being a consultant, our clients don't want us in their office contaminating them. So I've been remote 100% for 17 months now, and but some people are uncomfortable with that, and some leaders were uncomfortable with it. So I guess in that regard, it might have a negative impact, but I think overall it's just been a very, very positive thing that companies that, we've worked with companies for years trying to get them, they may adopt remote policies, but people weren't using it. And they always said it's because we don't trust that people are going to be working if they're remote, or it's just not possible to do this work. And true, many companies are still paper-based, and they're having to adopt digital very quickly. So I think there's just many more positives than there have been negatives in terms of, advancing workplace flexibility.
Sure. Thank you. We have time for a couple more questions, I think, maybe one or two. This next question is for Machiko. What role should employees play in moving paid family leave, both parental and elder, forward within workforces? Machiko, I'm sorry, you're still on mute.
yeah, just what to do to increase the more people to take childcare leave in Japan. Is that the question, Christina? Am I?
Well,
Yeah.
what can workers do in their own workforces to advance paid family leave, both parental and elder?
Yeah. Well, I think it's the regulation is quite strong, but yet some corporate culture, some companies are still not so friendly for those workers who are taking childcare leave. So I think it is maybe labor unions or co-workers are together, and then the just creating the sort of friendly atmosphere that anybody who are taking childcare leave, that is it's easy to do. So I think it's just a large corporation, there's no problem, but the smaller corporations still, you feel sort of obliged to leave, that the because of the culture, the corporate culture, not really friendly to those women or men who are taking care of child. So I think this has to be changed.
Thank you, Machiko. And I think we have about a minute left. This question is for all panelists. What role do you see for trade unions in progressing family leave? So maybe just real quick. We'll start with Sue.
I think it's critical. Unions were a major part of the campaign in Aotearoa, New Zealand, to get paid parental leave. And that is the way that most workforces, if they haven't got legislation in place from their country, it's the only way that they'll be able to actually advance that discussion is through trade union involvement.
Thank you, Sue. Nancy?
I think I would probably have to defer to Machiko on that topic, but you know, some of the unions, EY isn't a, unions are very different in Japan than they are in the U.S. But you know, I think in some cases they're very strong, and if that's something that they're trying to advocate for, the company would probably listen. Yeah.
Thank you, Nancy. And Machiko?
Yeah, I think it's just that the unions is very important, or even without union, there's some sort of the a group of the representative that listen to the voice of the workers, and that those groups should advocate the workers' right.
Thank you, Machiko. And Kathy? We'll wrap up with you.
Sounds good. Many of our trade unions across the United States have been really central and critical to the push for paid family leave across the states and cities and counties. AFL-CIO, a lot of the trade organizations on the continent have all been very, very crucial to the work, and they work as partners alongside advocates and lobbyists to get it done. I also would mention that small business organizations and trade unions for small businesses has been very, very critical, because they've been able to convince legislatures and council members across the nation that small businesses do believe and do support paid family leave. And that's been a crucial piece as well that's kind of moved the needle along.
Thank you, Kathy. And I think that's where time is up for our Q&A, and I will turn the floor back to Sarah.
Mahalo to our viewers for submitting so many excellent questions, and to our panelists for your thoughtful responses. While we have reached the end of Q&A, I encourage you to continue the discussion during open space. To participate in open space, simply remain online and take a seat at any available roundtable for an unmoderated interactive discussion amongst peers. The Center would also like to extend a warm mahalo to our moderator, Tina, and to our keynote panelists, Machiko, Sue, Nancy, and Kathy. The Center is honored to host such esteemed women. Thank you as well to our viewers for attending this Gals with Lake Global webinar. We hope today's discussions have left you with a sense of leadership, entrepreneurship, and inspiration. Thank you as well to our partners, Hawaii Children's Action Network, Hub Co-working Hawaii, Under My Umbrella, Blue Startups, ASU Global Futures Lab, We Empower, JWI Ecosystem, and Pacific Business News. Join us Tuesday, October 12th for the EWC Seminars live webinar The Future of Women in Afghanistan, a discussion on what the future holds for women in Afghanistan and how the world can most effectively support them. Panelist information and registration can be found on our EWC Seminars Live webpage, www.eastwestcenter.org/EWC Seminars Live. We also hope you will join us Thursday, November 18th for our next Gals with Lay Global webinar. Check our website for webinar information, registration, full speaker bios, and YouTube links at www.eastwestcenter.org/Gals with Lay. Finally, for those of you who wish to meet with today's panelists and the moderator, please remain online and join one of the roundtables for open space. Mahalo and see you soon.